Hi, good afternoon, and welcome to this month's webinar on men's health. It happens to be Men's Health Month, so it's Hello, my name is Michelle Moser. I'm a clinical liaison with Revelation Pharma. I welcome you to this month's talk on men's health. We're going to talk about medications and other ways of treating men's health that are not necessarily FDA approved. I will be talking about compounded medications as well. And clearly, this is for informational purposes only. Medical advice should be sought at the discretion of your medical provider. We're going to specifically hone in on what is low testosterone. How does that affect man's quality of life? What about metabolic syndrome? What is that and why is it important? Hair loss is important to women and men, but we tend to focus on men's hair loss a little bit more commonly. We're going to talk about different ways to test, including with hair loss, and a wide variety of treatment options as well. So men traditionally make a wide variety of hormones. There really aren't men's hormones and female hormones. There's just hormones, and they just come in different ratios depending on what gender that you are. So typically men make about 20 to 30 milligrams of cortisol a day. So that's a hormone that helps us keep us kind of balanced with our electrolytes, but also is kind of our fight or flight. It helps us to also take care of any infection that might be there. So it's very, very important. It's made on the adrenal glands. Men also make anywhere from 5 to 7, maybe even up to 10 milligrams of testosterone a day, which is very interesting because sometimes we see doses that get quite high. And with topical application of testosterone, about 90% of that dose is absorbed, especially if you're given a body map and it's applied to thin-skinned areas and areas that are less hairy. Androstenedione is made about 3 milligrams a day. Unfortunately, there's about 0.3 milligrams of dihydrotestosterone, and that's usually converted from testosterone. Men make estrone, which is E1, about 0.066 milligrams a day. And estradiol, or E2, about 0.45 milligrams a day. And both estradiol and estrone are rather potent hormones in the body, and they can be easily converted back and forth to each other. DHEA is, again, an adrenal hormone. And when it's sulfated, that's the difference between S and DHEA plain. And as a DHEA S, meaning sulfated, that means it's already gone through the liver and it's usually stored. And then it's stored at about 50 milligrams a day, whereas regular DHEA is prevalent about 15 milligrams a day. DHEA is the most prevalent hormone in the body. It gives us our sense of well-being. And I find that this is a very good resource if you're interested in reading more about men's health. So andropause is a general term that's given for kind of a mid-stage of life and what happens with hormones, usually a decline of very specific hormones. When there's a decline in testosterone and their metabolites, a lot of times will see depression or low mood, sometimes irritability, anxiety, even anger. A lot of times people fall asleep, men fall asleep right after dinner and wake up and then can still sleep through the night. There's usually memory or foggy thinking, concentration loss, muscle loss. So that is something that a lot of men recognize right away because their strength tends to wane. They become a little bit more fatigued, a lack of energy. Their libido or sex drive tend to drop off. Their erections may not be as strong as they once were, and the intensity of orgasms do decline as well. We also see bone loss in men. And that is very significant. Men do get osteopenia and osteoporosis. And with all of this, there tends to be a higher risk of cardiovascular disease and metabolic syndrome, which is the capacity in which to handle insulin and those carbohydrates that we take in. So andropause can last for years. It can sometimes last longer than what we would call menopause in women. It can vary via the individual. Sometimes we'll start seeing symptoms in the 30s. Sometimes we will see symptoms in the 40s or 50s, and it can literally last decades. But that doesn't mean that you have to suffer with it for decades. There are ways to go about and take care of this. So there's a wide variety of medications that can also decrease the amount of hormone around in the body, and those are specifically statins, pain medications like the synthetics or the natural pain medications, antidepressants, blood pressure medications, as well as those anti-inflammatories that are over the counter and prescription, and the stomach acid medications. So whether somebody has GERD or reflux, a lot of times they're given a medication, or if you're experiencing those, you might just go to the drugstore shelf and purchase those over the counter. And there's a wide variety of anti-seizure medications that can interfere and actually drop testosterone levels too. What I find interesting is that the symptoms associated with low testosterone levels are what we're actually seeing these prescriptions prescribed for. And so are we actually just making things worse by adding these prescriptions? In some situations, yes, but that doesn't mean that they can't be corrected. So some of the commonly asked questions that we get quite a bit is in pertaining to testosterone is, will it actually cause prostate cancer? And how do you know if you have low T? Is testing available? Well, the application of testosterone doesn't necessarily correlate to somebody getting prostate cancer. What we also know is that if you don't have enough testosterone, you're also prevalent or more susceptible to a cancer diagnosis. We know that estrogens, progesterone, and testosterone all play a key role in maintaining good immune status. So if you want your immune system to be nice and healthy, it's very important to balance your hormones as well. And how do you know if you have low T? Well, test. That's the easiest way. Some providers will take a look at testosterone in the blood or serum. They can also take a look at it in saliva, which is a really easy collection. You literally just spit in a tube. We send it off to the lab and it shows us what's going on. We can also look at it in dry urine, and that will give us an idea as to not only what are you producing, but then how are you actually metabolizing that? How is the testosterone going through the liver and then being delivered? It's a little bit more difficult, in my professional opinion, to dose off of dry urine testing, but it does give us an idea as to how healthy the liver is and how we can also support liver metabolism as well as hormone metabolism. Testosterone replacement therapy is usually bioidentical. There are some synthetic testosterones that can be used. There's a few commercially available products that are out there in a gel format. And usually they come in little packets and you apply the entire amount of the packet, which sometimes can be up to a teaspoonful. And that is a lot to rub in, even if it's a gel. The difficulty with that is that when you have a larger volume, it takes a lot longer to actually push that into the skin. And a lot of times we don't see that being effectively applied and rubbed in. If it's left to sit on the skin, it can then be absorbed into clothing or even transferred to other people. With that, that's lost dose. So how much are you actually getting? Whereas if we compound testosterone, we can identify which base is going to be best for your skin type. And that's something that providers can help with as well. But what we can also do is help concentrate that so you don't necessarily have to apply, a large volume. That is something that we usually discuss with providers when we concentrate that and or the patient, because that goes along with the device. So each device will deliver a different volume, and then we can take the prescribed concentration or dose and put it in that volume to ensure that we can make sure that the dose is appropriate. About 60% of men in their 70s are low functioning thyroid. So they're just not making, not thyroid, testosterone. They're just not making enough testosterone. And that's where we see most of the symptoms. That's where we see most prescriptions being written for. But we're also seeing a lot of 40-year-olds complaining of this. And some of them are even having a hard time conceiving. That's not uncommon that people are waiting a little bit into their 30s and even 40s to start a family or continue a family. And that can be a little bit of a challenge when pregnancies are just not happening. However, when we give topical testosterone or injectable testosterone, however we're given, that replacement dose can absolutely interfere with sperm production. So we have to be very careful about that dose. And again, if you want to read a little bit more about testosterone replacement, I give you 3 references here. They're all very good and very thorough, and they give you a little bit different perspective. So how does testosterone actually work in the body? Well, it definitely is a sex steroid hormone. It aids in sperm production. It's also very important in protein and muscle formation, the manufacturing of bone. So the replacement of and building of bone helps it to be sturdy. It aids in mental concentration. So men's brains tend to be bathed more in testosterone, where women's brains are bathed in estrogen. It helps to control blood sugar, and it actually helps to lower blood glucose levels at physiologic doses. Now, if we give too much testosterone, we can actually see an increase in blood glucose levels, and that is what leads to metabolic syndrome sometimes. Testosterone helps to regulate cholesterol. All hormones are made from cholesterol, so we do need some cholesterol in the body. That is the building block of every hormone that's made. So it goes cholesterol, pregnenolone, progesterone, then moves over to DHEA, then to testosterone, and onto estrogens. And then between progesterone, DHEA, and testosterone, that will also feed the androstenedione cascade and works with cortisol levels. It helps to maintain a really good, sturdy immune system. So when hormones aren't balanced, that's where we also see that risk of cancers are elevated, risks of other infections, whether they're viral, bacterial, fungal in nature. We do see a lot of times those opportunistic bugs take over when hormones are not balanced. And what we're also learning through research that's been done in the last 30 years is that testosterone helps to aid the brain against Alzheimer's disease. So I think that, again, that touches on one of those issues that a lot of people are a little concerned with. The older we get, what exactly are we going to be faced with? We don't want to lose our memory. We don't want a diagnosis of dementia or Alzheimer's. So there's a lot of things that we can do to help keep those diagnoses at bay. So like I said before, sometimes medications can decrease the amount of testosterone that is used in the body or even developed. But anytime someone's diagnosed with diabetes, that's going to change the amount of hormone that's available, which is interesting because then if you don't have enough testosterone around in a male body, then you actually have higher blood glucose levels. So it's kind of one of those catch-22 issues. And of course, we see a decline in hormone production just because we get older. But anytime there's trauma to testicles, whether someone rides motorcycles or dirt bikes or even mechanical bulls, we can actually see that there can be damage to that. And of course, infection and illness can lower testosterone levels. So moving on to another really big topic, let's talk about hair loss. So there is some genetic factor to how someone will maintain a hairline, and male pattern baldness is something that we see in a variety of patterns. And a lot of times we can look at families and understand where this is coming from. There have been some studies shown that it's actually covered on the X chromosome. So if you're a male, you want to look at your mom's dad and see what's going on there. But we can also see hair loss associated with diabetes and obesity. Those two issues usually go hand in hand. If someone's obese, a lot of times they have diabetes or metabolic syndrome. And if they're diabetic, a lot of times people are overweight. But of course, if your thyroid isn't functioning well, your body will kind of let go of those so-called non-essentials, and hair tends to be one of those elements that are not considered essential to everyday life. And as I said before, medications can also cause hair loss. And a lot of times they're the commonly prescribed medications, whether it's for high blood pressure, cholesterol, even sometimes antidepressants. Now, there is a medication used for blood pressure that actually stimulates hair growth, and that's minoxidil. But we really don't use minoxidil so much for blood pressure anymore. We're primarily using it just for hair loss. And of course, stress. Sometimes when we're stressed, we tend to be less active. We tend to go for comfort foods. But the whole adjustment to stress, that physiologic parameter that the body recognizes as stress, whether it's a mental stress or a physical stress, or even a physical illness, surgery, infection, that sort of thing, sometimes the body will let go of hair. Now, a lot of times that can be regrown, but if that then links to an autoimmune disease such as alopecia, then we have to be a little bit more concerned, because sometimes in those situations, those autoimmune diseases can be reversed to some degree, but maybe not fully. And we need to be careful with that. So tricho test is a way to identify what is actually happening in the hair growth process. It's available through Fagron Genomics, and it looks at 13 genes and 48 genetic variations associated with alopecia or hair loss. So it is through a DNA microassay testing that we're able to identify exactly where in the hair development process there could be some deficiencies. And then what we can do is personalize the treatments for that individual. Now, the test is a really easy, quick cheek swab, and you literally only have to do that once in your lifetime, because that process isn't necessarily going to change as you start losing your hair. The tests do come back. It takes a little bit for those to come back, but it is very accurate. We can then take a look at exactly what that assay says. It usually is about 5 pages long, and then tailor treatment specific to that individual's needs. Usually it's in a topical form. Sometimes oral medications are used, but usually it's a topical solution or gel that's applied to the hair and left on the hair, and that's usually applied once or twice a day. And we can vary the number or the strengths of the medications that are applied in that solution as well. Of course, some of these treatments are available over the counter. We've known about minoxidil or Rogaine for quite some time. It is in a fairly small strength or a weaker strength. And as a prescription medication, we can compound it much more effectively and maybe at a higher concentration. We do have limits on that concentration where the medication will stay in solution. If we go above those parameters, then we have problems with that. But often we can use medications to actually stimulate the hair bulb in developing that hair follicle. And we can also use other medications to reduce the inflammation that is associated with hair loss as well. Some medications have side effects that actually cause hair growth. And we saw this with an eye drop for glaucoma. And all of a sudden, people were having these beautiful, lush eyelashes, or even sometimes they had streaks on their face and there was hair growth on their face, especially for men. And what we found is that latanoprost can actually increase hair growth. It can also bleach the skin. So we need to be careful with that as well. And there's a few other medications that we use that are also associated for eye drops that we can apply to a compounded medication individualized for hair loss treatment. So cardiovascular health is also one of those conditions that a lot of people are very concerned with. Heart disease is very prevalent in the United States. It can be associated with our diet. The standard American diet is quite sad, SAD, standard American diet. But we see an elevation in cholesterol. And with that, it's the very tiny particles of HDL, LDL, VLDL that tend to be more troublesome. So if you do have a cholesterol screening done, make sure that they're also giving you the lipoprotein sizes, because that is very important to take a look at. And of course, anytime you have elevated blood glucose levels, that can be a trouble issue as well. It can cause inflammation of the blood vessels. It can actually increase blood pressure. But, anytime we have syrup running through our veins and arteries, that alone can be an issue. Increased blood glucose levels are very inflammatory. So we need to make sure that we can control those as best as possible, because that will help with vessel health, not just around the heart, but around the organs and also other body parts as well. And then we don't see as much peripheral neuropathy, and we don't see as much tingling and numbness in the hands and feet. So the best thing to do is to optimize hormones to ensure that we have good cardiovascular health. And associated with cardiovascular disease, there's a few things that you can change, and there's a few things that you cannot change. You can't really change your heritage. So is this just something that is very common in your ancestry? We can't slow down the aging process. We're very lucky to age, quite honestly. And we can't change our gender. That is something that physiologically that is innate. But we can change tobacco use, whether that is cigarette or cigar smoking or chew tobacco use. All of that can be closely associated with cardiovascular risks. We can pay attention to high cholesterol, to high blood pressure. We can change our physical activity, and it doesn't mean you have to train for a marathon. It can be something as simple as moving certain muscle groups frequently. It can mean even just 5 or 10 minutes a day to start with. If you start with small goals, they're much easier to achieve than if you have very large goals that are just not easy to obtain right off the bat. When we take a look at physical activity and sometimes high blood pressure, if there is a significant weight issue, that needs to be addressed as well. Sometimes that means that we have a low functioning thyroid, and we need to pay attention and evaluate that as well. And that's more than just a TSH. That means really looking at, yes, a TSH, but what's going on with free T4 or levothyroxine? So how much thyroid is actually being produced? How much hormone is being produced in the thyroid? But then really, is it being converted to active thyroid? Because if it's not being converted to active thyroid, or not effectively, then we will have a very slow metabolism, and that can increase our weight. It can also increase our cardiovascular risks. Stress plays a very large role, because if we are stressed, whether we feel it or not, that stress hormone can lower our thyroid function. It can also block other hormones in our body that can then lead to other risk factors. And of course, alcohol consumed above moderation is a risk factor as well. But these are all things that can be changed. Metabolism really is energy, and metabolic syndrome, it's also called insulin resistance or pre-diabetes. Of course, when we're diagnosed with full-blown diabetes, it's either type 1 or type 2. Type 1 is usually something you obtain in a much younger age, where type 2 is usually an adult onset. And that can be controlled with oral medications, sometimes topical medications, and sometimes insulin. Those injections are very easy to use. And of course, monitoring blood glucose levels is even easier today with the use of a continuous blood glucose monitor that's literally applied to the back side of the arm. And you can literally download an app on your phone and scan that. So you can actually see what's happening with hydration in the different foods that you're eating, even what's happening with exercise, so that you can better control your blood glucose levels so they can maintain a nice, healthy rhythm rather than extreme highs and lows. And that roller coaster ride can very much play with your mood and digestion, as well as just your energy overall. And of course, this all plays back to diet and mild exercise. So diet is kind of a nasty 4-letter word, if you ask me. I prefer to look at lifestyle opportunities, and we have a wide variety of really good functional medicine nutritionists out there that help you with understanding your relationship with food. So, is there previous trauma that actually will change the way you seek food and when you seek out food? Do you go after simple carbohydrates and sugars when you're stressed or when you're having a down time? That's very important to recognize and maybe substitute some better options for that. So we do have some great professionals out there. Some of them even work virtually, so you don't necessarily have to make a whole lot of effort to make these changes. What I believe is that there's a wide variety of practitioners out there that can really help us along our health journey. And some of them have great strengths in very specific fields. And so when we can tap into those strengths, that helps us to be a better, well-rounded, healthier person. Already alluded a little bit to thyroid health, but I think thyroid is one of those things that it is not as well understood and certainly not as well tested, but is the essential metabolic control warehouse of the entire body. So we've got to maintain good thyroid health, of course, good hormone balance. All of this gives good quality sleep. If we're not sleeping well, then we just don't have a very good day. We don't have a very good week. And if our chronic lack of sleep or sleep pattern changes, that can actually lead to more insulin resistance, more metabolic syndrome, more cardiovascular risk, and which then leads to a wide variety of other issues. Magnesium and omegas definitely help with all of the above. Memory is something that, we kind of joke about it, right? That we don't want to be that person where we walk into the kitchen and we're wondering why we're there. We kind of forget why we go about our day. So we kind of have to retrace our steps and try to remember where we're at. But that is nothing to laugh at. We are actually seeing more diagnoses of dementia and Alzheimer's in earlier ages. You don't necessarily have to wait until your 80s to be diagnosed. We're actually seeing this much earlier. But what we can do is we can take a look at all of the information, all of the science that's been produced in the last 30, 50 years. And what's interesting is that in men, testosterone levels tend to be the highest between the ages of 18 and 25, and then tend to decline after that. But what happens is that estrogen levels actually increase. And so with that, we see an elevated production of sex hormone binding globulin. Now, sex hormone binding globulin is carrier protein that grabs a hold of hormones and carries them off to the target tissues where they actually do their activity. Well, as estrogen goes up, the production of sex hormone binding globulin goes up, and it preferentially will bind testosterone. Well, when it's bound to this carrier protein, it can't necessarily be available to do its work. So it decreases the amount of available testosterone. So you may have plenty running around. We just need to unbind it, and we need to unbind it and then lower estrogen levels as well. And that can be done through, first of all, evaluating that. So taking a look at that in either serum or blood spot or saliva testing. And then there are very specific herbs and medications that we can target the metabolism of testosterone to estrogens and decrease that activity. That's all done in the liver, so we can target that area. What that can also do is help reduce the risks of metabolic syndrome, diabetes, insulin resistance, and therefore have better memory for many more years. There's a very strong correlation between what is happening in the gut and what is happening with insulin issues, the amount of blood glucose in the body, and then how we're able to recall and maintain memory. The connection to the brain and to the gut is becoming more and more understood, especially in the last 20 years. There's some amazing books out there that help us to understand more and more about why it's important to take care of our gut. It's not just about, well, putting up with burping and acid indigestion and reflux and all of that. That's just kind of, I'll just stay away from spicy foods and certain things that I drink and everything will be fine. It's actually much more than that. And what we found, especially in the last 20 years, is there are ways to actually identify what is going on in the gut. And that's a quick and simple stool sample test. With that, we're able to identify the DNA sequencing of exactly what's in the gut. There are certain good bacteria that help us to metabolize our carbohydrates, our fats, our proteins, but also those metabolic end products need to be in very specific ratios. And if we don't make enough GABA, if we don't make enough serotonin, most of which is made in the gut, then we're not happy. So again, that leads to mood disorder, but it can also change diabetes and metabolic syndrome. Akkermansia is a good bug in our gut that helps us with maintaining good blood glucose control. In fact, we know that's what metformin works on, is Akkermansia. Well, if you don't have enough Akkermansia in your gut, the metformin is not going to really help you maintain that better blood glucose control. Dr. David Perlmutter wrote a book called Grain Brain, and that specifically focuses on what's happening with gluten and what's happening in our gut, as well as our thyroid and metabolic issues, and then more so on even milk products. So a lot of us were raised that you've got to have so many glasses of milk or dairy a day to maintain good, strong, healthy bones. Well, that's probably not as true as we once thought it was. We get more calcium out of broccoli than we do milk. And there tends to be a lot more hormone in dairy products that actually decrease our ability to maintain good hormone level and good metabolism, good blood pressure, good cholesterol, etc. So perhaps we need to focus more on what exactly are we eating? What are we doing to put in our gut to see those nutrients be absorbed and produce good fuel for our brain so that we can live those productive lives that we're all looking for. Because when we reach those years that we are contemplating retirement, we don't necessarily want to be dragging around a suitcase of medications and braces and creams and ointments just so that we can go on those trips that we've all dreamed about doing in our retirement years. So it's a good idea to take a look at this as early as possible so that we have the greatest impact and we can make the better choices for ourselves. Sexual health is very, very important. It's one of those three categories that helps us to be a well-rounded individual. We need good food and nutrition. We need shelter, and we need the attachment to other people. Well, when we're dealing with sexual health, whether it's lack of libido, lack of, in men's situation, erection or full orgasm, those are very closely tied to what's happening with hormones. Has testosterone dropped off? Is dihydrotestosterone elevated? Is estrogen elevated? So if we don't actually test for those, we don't know. And it's not necessarily, those hormone imbalances aren't necessarily just in obese individuals. We can actually see these in very svelte, very height weight proportioned individuals as well. So it's a good idea to, instead of assume, just test. The tests are very easy to do. They're relatively inexpensive, and they don't have to be done every 6 weeks. They can be done even every 6 months to a year, depending on what it is that you're looking for. But we also have to take into account prostate health. What is going on? Is it swelling? Is it occluding the urethra? So someone's having a hard time voiding. Has the individual actually had to have some surgical intervention with the prostate, with the bladder, with the urethra to maintain that openness so that they can void and urinate? We also have to take a look at infection. So sometimes the infection, it correlates to the other gut biome issues as well. So if someone has urinary tract infections and it's primarily E. coli, do they have a higher prevalence of E. coli in their gastrointestinal tract as well? Usually, that's usually what's going on. And all of this ties right back to metabolic syndrome, which the incidence of which continues to be on the rise. When we see someone have erectile dysfunction issues, they usually have cardiovascular issues as well. So when we can make lifestyle changes to decrease the issues with ED, but actually increase sexual health, a lot of times we're also making a tremendous impact on cardiovascular health and metabolic health as well. Erectile dysfunction can happen at any age. You don't necessarily have to be in your 50s, 60s, 70s, and beyond. This can happen to people in their 20s. There are, of course, a lot of oral medications that have been designed over the years to help with trapping of blood supply in the very specific tissues of the penis that will then help with firmness. There are devices as well. But what we see is that if there's trauma, if there's the use of very specific medications or illnesses, that can all play a very strong role and lead to erectile dysfunction. Now, in more recent studies, we've also seen that marijuana smoking is very closely tied to erectile dysfunction because specifically in men, the THC will stimulate estrogen production, which, as we talked about just a moment ago, when estrogen goes up, testosterone usually goes down because it's being bound to sex hormone binding globulin, right? It's a big old vicious circle. So we need to make sure that things are well balanced and that we're looking at more than just one area. And to me, that's what functional medicine is all about. Now, when we take a look at some of the very commonly prescribed medications for ED, they don't necessarily always have to be oral, and they don't necessarily always have to be in the commercially doses that are available. So in the compounding world, we can make things that are rapid dissolve. So in other words, they can be placed in a film or a type of tablet that can literally be dissolved under the tongue, which means that the medication is going to get to the target tissues faster than if they were swallowed, have to go through the liver and then delivered to the target tissues. And then there's injectables that can be compounded as well, whether there's a mix of 1, 2, or even 3 different kinds of medications, all targeting different mechanisms by which the blood can be trapped in the penile tissues and then allow for a stronger erection and hopefully a better orgasm as well. But there's some other issues associated with men's health that I wanted to address that they're not necessarily always life-threatening, but they can be unsightly, and we hear questions about it all the time. So toenail nail fungus or even hand nail fungus is very common. There are some over-the-counter products that are available that can help decrease the unsightliness or the yellowing or thickness of the nail. And it does take time with continued application for the new nail to grow out nice and healthy. So it's not just a matter of applying something every day for a month and everything goes away. Sometimes it takes a lot longer. There are prescription medications that are oral. We do have to be careful of liver function tests in monitoring exactly what's going on, because those medications can interrupt and cause other liver issues. And there are some laser treatments available now that can actually target that nail bed, because those dermatophytes aren't necessarily under the nail as it grows out. A lot of times they're deep underneath the cuticle where they kind of hide and linger and multiply. And then as the nail grows out, it becomes thicker, usually more yellow, sometimes even black. And then we need to cut it back and clean it out and apply product. So sometimes it can take 6 to 9 months. And of course, if someone doesn't pay attention to their diet, if they're still consuming a lot of simple carbohydrates, alcohol, sugars and things like that, that actually is going to feed those dermatophytes or those fungus that are there. And sometimes if you have fungus under your nails, it's a possibility that there's fungus growing in the gut as well. Chronic pain affects men more so than women. It tends to lead to many missed in the year. It is prevalent in approximately 60% of men. A lot of times it's diagnosed in the first part of the week because people tend to overdo it on the weekends. They might be out hiking or boating or exercising, playing games, different athletic activities that can pull and stress and strain and cause soreness. But when pain becomes chronic, and it's usually in a shoulder or lower back that men tend to have more complaints about, we can usually correlate that to an overuse syndrome or even a disturbed or imbalanced hormone issue. So if we optimize hormones, we can usually see that pain issues minimize. But we can also take a look at micronutrients. We can look at magnesium, turmeric, boswellia, even digestive enzymes. So digestive enzymes, when we take them with food, they help us to break down those carbohydrates, fats, and proteins. But those same chemicals, betaine, papain, other amylases and things, if we take them in between meals, they actually help to decrease inflammation throughout the body. Now, we can target exactly what tissues need to be strengthened, and we can use physical therapy, we can use chiropractic care, we can use a wide variety of infrared saunas, but we can also use low-dose naltrexone, which is a prescription medication that works to decrease the inflammatory chemicals that are produced in the body when we have an injury or an inflammatory process that is due to a wide variety of issues. Low-dose naltrexone also helps to stimulate the immune system. Sorry, not necessarily stimulate, modulate. That's a better word for that. But let's first talk about testosterone replacement. So what is it? How do you do it? It can be done in a topical or a transdermal cream gel. There are several products that are commercially available. We compound a lot of strengths. It's all individualized in the dosings that are available. There are injectables that are commercially available, but also compounded. Just depends on the oil carrier that the testosterone is placed in. Testosterone is always placed in an oil, so it can dissolve. Hormones are oily substances. Usually these injectables are given either weekly or monthly, and they're deposited usually in the muscle. There's also a variety of topical patches that are commercially available, and most of those are applied once per week. And the creams and gels are applied once a day. And we usually hand out a body map so that it's easier to understand where to put them. If it's a younger individual, we want to stay away from the testes or deep inner thigh so that we don't necessarily interrupt sperm production as much as we would if we applied it there. Sublingual troches or rapid dissolved tablets or liquids are placed underneath the tongue, and therefore when the medication is absorbed through the capillary and venous system under the tongue or in around the gum line, it goes directly to the target tissues first before it comes back through the liver for metabolization. And then we see more medication being delivered to those target tissues before the medication's changed by liver processes. We also see dermal pellets, and these are small cylinders that are put under the skin. And in that, they usually are placed and left for about 3 months. And that dose is usually determined based on a serum level. What happens with dermal pellets is something that can be painful. It has to be administered in a doctor's office. It can be rather convenient for some people, but once the dose is in there, it's in there. And it does take about 3 months for the dose to subside. So you may have a roller coaster effect, similar to what you may see with an injectable or a patch even. And what happens is that the dose is placed either with a pellet, a patch, or an injectable, and then the dose is very high. And then over time, it will wane, it will decrease. And then at a very specific interval, then we replace it again, and then you get another spike. Whereas with topicals or transdermals, when it's applied every day, that tends to be more of a steady state, an even amount that is used in the body. If we apply too much testosterone through any modality, we can see an increase in metabolic syndrome, an increase in blood glucose level, increase in cardiovascular disease, mainly because of the increase of dihydrotestosterone and estradiol. So we want to make sure that we're giving just enough and not too much. And like I said, men typically make between 5 and 10 milligrams a day at their peak. These are 3 different ways to test. You can take a look at it in saliva or even blood spot. You can take a look at it in whole serum and also through urine testing. So these are different manufacturers and different labs that provide for that. ZRT Lab does not only saliva, but blood spot and dry urine, whereas Precision, the Dutch test, is only a dry urine. So that's going to take a look at metabolites. The dry urine is how much the body is utilizing, and then how much is it actually pushing out. And those types of metabolites that are then formed can give us an idea as to how well the testosterone is utilized in the body. Is the liver actually metabolizing it through the good pathway, the not so great pathway, or the terrible pathway? Serum testing or blood testing tends to be more of the gold standard. And in my professional opinion, it needs to be done first thing in the mornings when hormone levels are the highest. And a lot of times I see that patients just go to the lab whenever it's most convenient. And sometimes we're not seeing very accurate readings, especially if they're already on therapy. If they are on a topical therapy, it is more commonly seen in saliva tests to be able to understand how much the body is actually absorbing and utilizing. So with the passive migration of the hormone through the salivary glands on the way to the target tissues, that is a better indication of a cellular level of hormone versus blood or serum, which is literally transitory. Hormones aren't supposed to stay in the blood. They're picked up by sex hormone binding globulin and carried off to the target tissues. And of course, urine testing, as I said, is all about what the body's already done with that. So in my professional opinion, it's much more difficult to dose on what is happening with dry urine than it is with saliva. There's some other metabolic labs that I think are very important as well. When we take a look at testosterone, we need to take a look at a total and a free. I believe that we should also be looking at a sex hormone binding globulin as well as an estradiol, if not an estrone level as well. When estradiol and estrone levels are higher in men, we see the development of breast tissue. And men get breast cancer too. So this might be a way to identify an issue earlier than typical, and maybe make some changes using whether we're going to go after herbal medications or other very specifically designed allopathic medications to then decrease the amount of estrogen in a male body. We should look at DHEA from time to time, do a good CBG or CBC. Looking at a continuous blood glucose monitoring is always helpful. We need to look at PSA, progesterone, albumin, and cortisol, and those all play very well together. And this is what we would look at in serum. Minerals and vitamins are really important, whether we're dealing with ED, whether we're dealing with chronic pain or metabolic issues. Vitamins are the essential building blocks to ensuring that we produce and manufacture enough amino acids, that we have healthy mood. So if somebody is tired and grumpy and fatigued, maybe they are not converting their hormones directly to serotonin. That's mediated by B6. So that B vitamin tends to be utilized much more and burned up quicker in stressful situations. Magnesium is essential in over 300 chemical reactions in the body. It's absolutely mandatory, helpful for heart function, blood vessel function, erectile dysfunction, everything. And without enough magnesium, which is a natural muscle relaxer, we do see more situations of pain. Now, if you're of Northern European descent, you may not utilize vitamin D as well. But what we also see is in very dark-skinned people, the sunlight doesn't necessarily get through those melanocytes to produce enough vitamin D. So a lot of people need supplementation. And how much is enough? Well, if you don't test, we don't know. So drawing a vitamin D 25 hydroxy blood level or blood spot level can really identify what is necessary. Vitamin D is essential for modulating immune systems and ensuring overall good health. And what about omegas? And what is EPA and DHA, and why are they sometimes in different ratios? So omegas help us to lubricate our joints. It helps with metabolism. It helps with maintaining blood glucose control. And that's really helpful for also cardiovascular health and urinary health, as well as overall health. Let's just go with that. So there's also some other herbal medications that we can use for prostate health, whether it's nettle or pumpkin seed. Those are also very, very helpful. Saw palmetto helps to decrease the amount of dihydrotestosterone in the body. So that is very essential in maintaining good prostate health and keeping that prostate exactly where it's supposed to be. Now, if you're supplementing with zinc, please add copper. So with every 15 milligrams of zinc, 1 milligram of copper is important so that we don't go down the road of looking at a disturbed process of being able to form clots. And if any time you ever need to purchase or need some help purchasing vitamins and nutrition, let us know. We can help you with that as well. So let's talk about what you can do today or tomorrow, because a lot of times what the information that we provide doesn't necessarily say, well, what can the patient do? Because every time the patient can help themselves, we're going to see a better outcome, a better patient outcome, a healthier individual. So patients can be shown how to look at nutrition properly, how to really evaluate if you are going to eat a simple carbohydrate, does it need to be added to protein? And how much protein is actually appropriate for any given age? How much exercise is important? Of course, there's genetic tests that we can evaluate all of this as well, looking at some of those core indices to understand what happens with caffeine metabolism, proper exercise in that specific individual, as well as organ health. I mean, there's other genetics tests like 3x4 genetics that can be very helpful in this situation. And of course, optimal hormone, vitamin, and mineral status You can test for all of that, whether we're using Vibrant America or SpectraCell to really identify those micronutrients and see what needs to be replaced or reduced. Very important to maintain that nice, healthy balance. And sometimes patients are not wanting to pay for a wide variety of tests, and I get that. I like to ask questions. I like to give them as much information as possible so that they can help me guide them in making decisions on what's best for them. I don't want to assume that that individual in front of me can't afford this or that or the other thing. I'd rather give them the information and then they can tell me what exactly they want to do. Preventing andropause is feasible. It's possible. All men experience a gradual decline in their testosterone after the age of 27 to 30, and that's quite normal. But we can slow that down and certainly identify exactly how quickly it is dropped by doing some very specific tests. Yoga, finding some mindfulness, meditation, moderate the consumption of alcohol, check your diet. A lot of them that are available online. Stay active. And for some individuals, it's not about training for a marathon. It can be mentally active as well. So are you doing Sudoku puzzles or crosswords or knitting, even just other mental challenges of trivia? Sometimes that's really fun too. And staying engaged with other people, staying in contact, and maybe playing golf on a regular basis. That's important for that buddy system to chat and get to know each other and then support each other. Getting enough sleep is absolutely critical. And there's a wide variety of apparatuses, watches, rings, other devices that can help people to understand, are they really sleeping well? And are they awake? Are they getting good deep sleep? Are they interrupted sleep, and why? And then it can help them tailor what's going on during the day, or even have better sleep hygiene. So maybe some calmer time for an hour or two before they actually want to get to sleep. Maybe it's not necessarily getting to sleep, but staying asleep that's an issue. And of course, we can evaluate that with a simple saliva test and see what's going on with cortisol. And perhaps that's what's causing some issues. And maybe teaching someone how to meditate and put all of those issues away so that they can get to sleep and stay asleep. So we talked a minute ago about low-dose naltrexone. So let's go into this a little bit deeper. So I am an international LDN consultant. I'm an LDN master. And what we find is that low-dose naltrexone is very appropriate for a wide variety of situations. Naltrexone is available commercially in a 50 milligram tablet, and it's used in 50 to 300 milligrams to help people decrease their alcohol cravings or even methadone use, et cetera. But when we take a look at a wide variety of studies, and there's literally over 900 studies that have been done in the last 40 years or so, the naltrexone's been around since 1964. It was FDA approved way back, almost 60 years, right? So, but what we've learned in the last 40 years or so is that when it's dosed at different levels, we can affect very specific areas. So for example, microgram dosing, 1 to 2, up to 5 micrograms, we can actually help somebody get off their opiates. So that was a study that was started with the commercial product Oxytrex. It was a study medication that actually had a little bit of oxycodone and a little bit of naltrexone, 1 microgram of naltrexone in there. And what happened is that as they decreased their opiate use and we increased their microgram dose of naltrexone, they literally lost the need for the opiates. And a lot of times their pain was much better controlled. So that led to, well, what happens if we move that microgram dosing up for chronic pain? So that moves us into the very low dose parameters, which is about 0.1 milligram, which is 100 micrograms. And you can even back that down to 50 micrograms or 0.05 milligram. And when that is dosed anywhere from 1 to 4 times a day, we can see that pain is blocked and people actually function better. So in Norway, they did a study, and this study was done about 10 years ago, where they literally told their providers, you're not going to prescribe pain medications. You're going to use this low dose naltrexone, and you're going to dose it in these parameters. And we want to see what happens with pain control. And literally, they moved their use of opiates to somewhere in the 20 to 25% range versus where it was at 80 or 90%. And they found that not only did low dose naltrexone work more effectively, but it led to better energy and better quality of life in the majority of these individuals. So you can actually watch on YouTube the Norway study. And I think it was just super cool how they've done that. But like I said, there's over 900 published papers on the use of low dose naltrexone. And if you don't want to read all 900, there's actually much more than that at this point. I think in 2017 or 2018, there were 900. And in the last few years, there have been probably another 50 published or so. But we can use low dose naltrexone in a variety of doses. It is combined with bupropion for weight loss at a little bit higher doses. But when we use it in 0.5 milligram or 0.1 milligram up to 9 milligram, we can actually modulate the immune system. So what are we trying to do with alopecia? What are we trying to do with Hashimoto thyroiditis? What are we trying to do with a wide variety of other autoimmune conditions, multiple sclerosis, Crohn's disease, those sorts of issues, even viral infections or vector infections like Lyme disease, Epstein-Barr? We can modulate the immune system with this medication and have much better outcomes. And it works well with other medications. So you don't necessarily have to stop everything else to use low dose naltrexone. But if someone's already on opiates, we have to be very careful about the dose and the timing of using low dose naltrexone, because one of its modalities is that it will intermittently block those same pain receptors as Vibrezzi, as some of the other traditional pain medications. So we just have to be super careful. So if somebody has IBD or IBS, we have to be careful about some of those medications as well, because they work on similar receptors. So this medication is compounded in doses that are specific for that individual. On this previous slide, I actually show a low dose naltrexone starter kit, where we start with a low dose and slowly increase the dose over time. And then also in the lower right-hand corner here, this is a liquid start kit where we're actually using a twice-a-day dosing. And there are some providers that actually use up to 4 times a day, especially for chronic pain. But when we compound it, we will compound it in capsules, in tablets, in sublingual drops, troches that are dissolved under the tongue. Transdermal gels are primarily used for autism situations where people are not able to take things orally. For example, in autistic children, a lot of them are not oral, so they don't take medications orally. We see doses of 0.1 milligram up to 9 milligram for neuroinflammation, depression, autoimmune issues, GI issues, skin issues. So even like eczema, Hailey-Hailey disease, pemphigoid, a wide variety of other skin conditions. When we move into a 4 to a 48 milligram dose of naltrexone, that's where we typically see issues with weight loss. Although some people will lose their appetite or even their craving for alcohol at much lower doses. Like I said, in the 50 to 300 dosing parameters, that's where we'll see it used for alcohol overuse syndrome. But chronic pain, anywhere from 10 to 100 micrograms or 0.1 milligram to 0.1 milligram, usually chronic pain. And that's sometimes once a day dose, sometimes multiple day dosing. We have to be careful about compliance, right? Because anytime that we're dosing anything multiple times during the day, we need to be very upfront with the expectation. So how closely is this going to match the patient's expectation of how quickly are they going to feel any results? What side effects are they going to feel? And how do we check in with them? And if something does crop up, is it their underlying issues or is it low dose naltrexone? We got to be careful because sometimes people quit because they assume that it is some side effect that's popped up where it might not be the medication, it may be an underlying disease, whether it's diagnosed or not. Sometimes daytime dosing is used in the morning, noon, early afternoon for depression, psychiatric use, and sometimes pain. Usually we start with bedtime dosing, and that's because we can see the upregulation of endorphin receptors. And though that upregulation of those receptors can last for up to 18 hours. So we do see better use of that. Now, when we talk about side effects with naltrexone, there's, especially in low doses, there's really very few. Sometimes we hear about vivid dreams, and that is telling us that it's actually working because it will drop people into REM sleep where they dream. And a lot of times when they have chronic illness, they may not dream at all, or they may not remember dreaming. But that can be an issue where it interrupts someone's sleep. So if that's the case, then we literally, if it doesn't resolve within 7 days, we move them to daytime dosing. So it's not too much of an issue. If somebody has constipation or GI issues, it's because it's LDN is binding to the opiate receptors, which we know works especially for Crohn's, ulcerative colitis, IBD, IBS, etc. So low dose naltrexone, it really is low risk. There's very little drug interaction. We do have to be careful of the biologics or similar pathway use. But most of the time it's literally what has the practitioner got to lose? Absolutely nothing. It is not usually going to cause side effects. If anything, it's minimal, and it's almost zero with ultra low dose. We can slowly increase that dose until we find that individual's happy dose. And I think that's probably the biggest issue that providers have, is that they want a concrete dosing schedule. And there is not one. There is what we've seen in the science and case studies, especially over the last 40 years, is that this medication needs to be tailored to that individual's needs. And that's where a compounding pharmacist is really going to be able to help you. Pardon me, because we're able to work with the patient and give them tools by which they can identify how well they're doing now versus maybe 4 weeks down the road or 2 to 3 months down the road. And it's literally a series of questions. It's a quick app or a link to an app that they can use, and it works wonderful. We just see better outcomes, much more successful outcomes. And this information can be given back to the provider as well. Sometimes very specific disease states will use twice a day dosing, sometimes 3 or 4 times a day dosing. And it's really low cost. A 3-month supply can easily be under $100. And that's not bad when we're talking about something that is identified for that individual and has so much potential to take care of symptoms that literally people have been dealing with for decades and have seen multiple providers. And so if you're a provider who wants to learn more about low dose naltrexone, let me know. I'm more than happy to help with you, help you to understand what it is. I'm happy to help you with dosing guidelines and understand those parameters by which we use low dose naltrexone. It's always my goal that the providers can be the heroes in this. Patients a lot of times will come to the provider and say, this is what I want to try. And in this situation, I think it's worth a shot. We just have to be upfront with patients that if you're using opiates or synthetics, we have to time this appropriately. You need to minimize that use. And this is how quickly or not quickly this medication is going to use. So it's really about communication and good expectations. But we can help you work with whatever remedies you're looking for on a routine basis. We can help with supplements. We can help with non-traditional therapies. And can also help the providers take care of themselves, because it's really about what's finding best for you and what you're most comfortable prescribing, but also what's going to help your patients. And a lot of times there are scenarios or statements made by a patient that we have heard that maybe is not shared with the provider, but we are happy to do that as well. And maybe there's another little trick up our sleeve, another medication that might be therapeutically beneficial. So in July, I'm going to be presenting on small intestinal bowel overgrowth, bacterial overgrowth, fungal overgrowth, and beyond. What it is, what are the symptoms, what kind of testing can be done, what kind of treatment options are available, and can you really feel better in 3 to 6 months? Because people with SIBO and SIFO, oh boy, sometimes they have a lot of issues. So thank you very much for joining me today. I look forward to seeing you next time, and I hope you are all well. Take care.